Hello, Dr. Jason Tomsic, and I want to talk about the three different types of abdominoplasties that we offer here in our practice. So the first type is the traditional abdominoplasty. The traditional abdominoplasty is going to treat excess skin on the abdomen. It's an incision that is very low. A flap is then raised up to the level of the umbilicus. An incision is made around the umbilicus. That flap is then continued about as wide as the rectus muscles, so about this wide all the way up to the bottom of the chest bone or the xiphoid. The reason for that is when we're doing these tummy tucks, most often we are fixing a diastasis or a widening of those rectus muscles. And we see that in weight gain, and the most common reason we see the diastasis is after pregnancy. So we have access to that full diastasis to repair it. The skin is then pulled down. A new incision is made for the umbilicus. The umbilicus is brought up through there. And that's basically the traditional or standard abdominoplasty. One of the other abdominoplasties that we offer in our practice is a mini abdominoplasty, which is for someone who just has a very minimal amount of loose or extra skin down below the belly button. And so what this involves is aggressive liposuction to the abdomen. That basically does the dissection, and then an incision is made low like the traditional abdominoplasty, but less skin's taken out, and that skin is pulled down. We don't go up to the level of the umbilicus or belly button at all. The scar is still about the same. Sometimes it can be shorter than the traditional abdominoplasty. Sometimes it's about the same length. The third type of abdominoplasty that we offer in our practice is what we call the hybrid abdominoplasty. And what this is it's for someone who still has that diastasis, still needs the tightening of those rectus muscles, but doesn't have enough skin to bring down the incision right at the level of the umbilicus and have that come down. So there's basically two different categories of this. Sometimes what happens is that incision where the belly button was comes almost down to the abdominoplasty scar, so there's a little T left. You have the incision across the bottom and just a little T there. Other times you can't get that all the way down, so you end up with a little incision where your belly button was, somewhere between your belly button and the abdominoplasty scar. Again, still gives us access to repair the diastasis, and that's why we do it. So those are the three types of abdominoplasties we offer here in our practice.